Hi, this is your Houston chiropractor, Dr. Gregory Gonstead, and we have Noto back here with us today. And he's from Los Angeles, and he's here in Houston for the week for us to treat him. Now, we were originally treating him for a shallow breathing issue and some back problems that he's been suffering with, but he's related to me today that he's also been suffering from some acid reflux and hiatal hernia issues, which has been going on for a while, and you've seen other doctors for that too, right?
Yes.
And this, you said this is kind of your last stop, right?
Yes.
So we're going to show you how we treat not only the shallow breathing, which is very much associated with acid reflux and hiatal hernia, but we're going to decompress him and we're going to adjust his rib cage. We're going to pull his stomach down through his diaphragm. We're going to do the whole thing today. So let's take a look here in the mirror for me a second. Okay, I'm going to have you close your eyes again and bend your head forward and backwards, please. And then neutral. You got good range of motion today, though. Your head's still a little bit forward, though. Take a look in the mirror with your eyes only. See how you lifted your chin up? Your chin was a little bit down like this, so you're kind of looking down at this angle. And your ear's dropping right here over your clavicle as opposed to being back here over your shoulders. That's normal biomechanics. And from the front view, you see how you're a little bit right still? Left shoulder's a little higher. And here you got more space. Here you got less space. So your pelvis and thoracic spine have shifted this way while your neck shifted that way. So guess what's going on in between? A little curve right there. Okay, so let's go ahead and lay you on your back here then. So. There we go. And we want to thank y'all for subscribing and watching our videos and commenting, and slide down just a little bit, sharing our videos on social media. We're getting a whole bunch of new subscribers, and we want to thank you for that. And you know, we seen some really severe patients today, haven't we?
Oh yes.
It's been really busy. This is the first opportunity we've even had to do a video. And see, this is the way you want to sleep too, is on your back with your head laying flat on the floor or the bed with your legs elevated. And a lot of people get a couple of cushions off their couch and put it under their legs. But if you were to go home and lay on the floor and put your legs up on the couch, that's how you should sleep. Alright, so he got his first ring dinger yesterday. And today will be his second. And just breathe through your nose for me. And exhale. Just like that.
Oh.
Yes, sir.
Oh.
Ring dinger. Home run. And he's still kicking big time.
Oh.
Felt that all the way down though, didn't you?
Oh.
There you go. Keep breathing. There you go. That's it. We got a real treat for you this evening too.
Oh.
We're going to get a wireless mic set up this evening. You know, we got one of your favorite YouTube video personalities going to be back in the office this evening that we're going to be doing. Okay, now so let's come over here on your tummy. Let me help you up sideways.
Oh.
Yeah.
Oh my God.
Yeah, that's definitely the real deal. That's not a minor adjustment, is it? There we go. Okay, let's go ahead and lay on your tummy there. We had a gentleman coming in here today. His legs were collapsing out from underneath of him. His pinched nerves were so bad, his low back and lumbosacral spine. And he walked out of here a whole lot better. First visit today. Right leg is short by about a ½ an inch here. Now when I bring it up, it actually stays short, but that tightens up right there, doesn't it? Feel that tighten up in your low back a little bit right here? Yep. So see, his pelvis was shifted to the left, so we're going to do exactly a mirror image of that and put it to the right. And then I'm going to pop up his lumbosacral spine, pelvis, and we're going to adjust him P to A in the Z-axis and in the X-axis. There's the Z mostly. That's L5, there's L4, L3, L2, 1, there's T12, and then we're going to move up into his thoracolumbar area. There we go. Exhale, just like that. I'm going to put your head forward just a little bit more here. And that's it. Okay. Alright, let's see here. Okay, now your legs are exactly even. And they stay even. Does that cause any tightness this time?
Not really.
Okay. Still sore right there though, huh?
Yeah.
So he's going to be seeing Joseph after he gets done here with me. But I'm just putting some deep, steady pressure right down here in his quadratus lumborum and multifidus muscles. This will help relax him, even though it hurts while I'm doing it. Boy, you can tell that's ropey. Right there. Okay, good. All right, my friend, let's turn you on your back now.
Sit on my back here?
Yes, sir. And just going to have your head on the headpiece right there. Perfect. Okay, I'm going to switch this to where you're going to feel your headpiece popping up. Now, this adjustment, I'm bringing his head superior, posterior, and then extending it backwards to restore the normal cervical lordosis. There we go. Good. Now, let's slide you down this way a little bit. And because he's been having some shallow breathing and restricted breathing, I'm going to put your arms out like this to the sides. Yeah, just straight out. I'm going to adjust his AC joints, which is his acromioclavicular joints right here. And then his sternoclavicular joint right here, where the clavicle meets the sternum. And then his costosternal joints, where the ribs meet the sternum in the front. This will open up his chest and ribs. It's worse on this right side. Does that feel tighter over here? Now, today, because he's told me about his acid reflux, just relax those both. I'm going to actually grab his stomach and pull it down. Take a nice deep breath in. Exhale. And you'll feel my hand sinking in there. Did you feel that gurgling? Now I'm going to pull your stomach down. Just keep exhaling for me. Blow all your air out. And you know, one of the things that we find in most of our patients is when they've been in pain for a long time, they have a tendency to hold their breath a lot and not breathe properly. So we try to help our patients to breathe better through conscious effort, but also recommend Tai Chi as a excellent way to improve your breathing and your coordination skills as well as your chi energy. Now see, his right rib cage is a little bit lower over here still. So I'm going to have you put your arms out to the side one more time. Both of them. Okay, now I'm going to adjust superior and lateral. Good. That's better. Now that made about a ½ an inch difference right there. Okay, good. And you relax your hands on your tummy for me now. And just let your knee go. There you go. Should have felt that in your knee and your lower back, did you? Mm-hmm. Okay. Same thing here. There you go. Good. Better. Good job. Now a lot of you have made comments on there about, or some of you have anyway, about how do you move the lumbar spine without doing a lumbar roll? Well, I just moved his entire lumbar spine with that spinal decompression, the ring dinger, and I also moved his lumbar spine in the Z and X axis, dropping it with this drop table. But I'm going to show you, I do know how to do the Gonstead side posture. Let's lay on your side towards me. I know how to do these adjustments. I just don't do them that often because I don't want to loosen up the patient's lumbopelvic ligaments. There we go. Felt that, didn't you? Yep. Okay, let's turn this way. Bring this out a little bit more. This one you want to really adjust P to A, just like that right there. Good job. Okay, let's lay you back on your tummy for a second. So I know how to do those adjustments. I took Gonstead while I was in Palmer. Now see, his legs are exactly even. Tell me if this feels any easier for you this time.
Yeah, a little
A little better? Okay. So you didn't tighten up as much, and it doesn't feel as tight down here right now either. That's a little tender still. Right there. Okay. I'm going to slide down just a little bit this way. I'm still going to do a P to A adjustment on your cervical spine. And there is not a chiropractor alive that gets a patient in severe pain as Anna Marie was in, which you saw her all bit forward in an antalgic posture, and Dr. Ian took care of that kid in Australia too. But that didn't all happen in one visit. That happens over the course of a few visits, several weeks, or even months. Because when a person's got severe herniated disc and nerve root impingement or radiculopathy, okay, let's go ahead and lay there for a second. Nope, I'm going to do the turbo nair on you. Okay, let's stand you up over here in front of the mirror. I broke the trigger on my Atlas specific adjusting instrument yesterday, so I brought in my one I have at the house to do myself with. Okay, I'm going to have you bend your head forward and backwards for me again. And then back to neutral. That's much better already. Good. See how you have more equal spacing here now? But your head's still a little bit right. It's not as far forward. That right there is your mirror image. Adjust your atlas on the x-axis there, there. I'm going to hit your traps right here. And the rhomboids. Reset those muscle spindles. Okay, try that same thing again where you flex forward and backwards. This should feel smoother to you this time. Yep. Take a look now. You're right down the gut everywhere. Good job. How's that feel compared to when you walked in? Can you breathe a little better? Oh, that's right. You had TMJs going on today too, you told me about. So I'm going to lay you back on your back here with your head up here, right here. I'm going to show you how we adjust the TMJ joint today too. Okay, open your mouth for me as far as you can. Now close it and then open it again. Now see his kind of goes zigzag down. Okay, relax it. Okay, now open it halfway and just relax your jaw. There we go. Okay, now I want you to open your jaw against my hand. Okay, relax it and open it. And relax it one more time. Okay, good. That's it. So now open and close it again. Okay, it's not zigging so much. It's going down a little bit to the left. Okay, relax it back and open it again. Yeah, that's better than it was. Good. Did that feel any easier to you? Can't tell yet? Okay, let's sit you up and face that way and let me do your shoulders. Okay. TMJs are very difficult. They have the highest innervation of nerves of any joint in the body. So that's his shoulders, elbow, wrist, and all the way down to the digits. Good. Okay. Very good. Okay. Let's take one more look at it here in the mirror. Now we've addressed a lot of different things in this visit. Okay, let's have you bend your head forward and backwards again. Okay, now open your mouth. That's better. That's straight. See, it's not deviating down. And now close it and then open it. Yep, there's no popping in there either, huh? I don't hear any clicking or popping in your jaw, do you? Okay, good. All right, so this is your Houston chiropractor, Dr. Gregory Johnson at Advanced Chiropractic Relief in Houston, Texas. And yes, we do know how to do Gonstead. We'll see you next time.